We get lots of questions about Mommy Makeover. And I think that's true because it's so relevant, so popular. You usually don't have to explain to patients what a Mommy Makeover is. It's addressing the post-pregnancy changes that you get in the breast, tummy, and body that don't respond to any diet and exercise. Now, that being said, there are lots of options under that. When it comes to the tummy, it usually means that there's going to be a tummy tuck involved because most ladies who've had 2 or 3 kids are going to have some loose skin, and loose skin is what determines whether you do a tuck or not. Some people will respond just to doing lipoplasty, but most people it's going to be a combination of tummy tucking and lipoplasty. The breast usually lacks shape and volume. So adding some volume, sometimes for the purpose of having more volume in the breast, but sometimes just for the purpose of giving more shape to the breast can be done at the same time that we do a lift. So lots of different options on the breast, but it usually involves some kind of a tucking procedure to lift the breast and at the same time adding some volume. That needs to be decided with your surgeon's consultation. And it needs to be individualized to what you want to achieve. The body sculpting has really grown in the last several years. A lot of ladies who've maximized diet and exercise, they get real frustrated about not being able to change certain parts of their body, namely the lower back, the thighs, the upper arms. We do anything from traditional liposuction all the way to laser-assisted or power-assisted lipoplasty. I use the term lipoplasty because I think liposuction doesn't really describe everything that we're doing with that. A very logical follow-up question by patients is, can you do it all at the same time? We'll often combine any 2 of those 3 areas together in a quote average patient. Sometimes we encounter a patient that we just need to do just their tummy or just their breast that day. But for most people, we can combine either breast and tummy, tummy and body, body and breast, one of those kinds of things. And we'll, once again, individualize that plan to the patient with the overriding goal of being as safe and low risk as we possibly can. Recovery from many of the things that we do with Mommy Makeover, it's pretty standard. What I'll tell you about the breast is going to be pretty close to what it would be for the tummy. 1 week of no vigorous activity or heavy lifting, things that you would strain at, that kind of communicates what we don't want you to do, is what we would have you do for once again 1 week. You're walking that night of your surgery, you're showering the next day, you're driving as soon as you're not taking narcotics for pain, which is usually a day or 2 max these days. After the first week is over, I'm going to say if it really hurts when you do it, stop. Just don't do it. Listen to your body. If it's just kind of sore, that's pretty par for the course, and just be cautious with that for the next 2 weeks. So 3 weeks total, you're 90% healed. 80% of your swelling is gone in 2 weeks. Most of our patients say at about the 6-week point, they have times during the day where they forgot they even did this. So just within a day or 2, you're showering, walking, driving, wearing normal clothes to where someone just looking at you externally is not going to be able to touch you, had anything done. So I'm not sure we can get the recovery any faster. And if you'd like more information about Mommy Makeover, call us at Clinton Plastic Surgery, 408-9787. That's area code 205. Or contact us through our website at clintonplasticsurgery.com.